there is reason for this enthusiasm. One has to, like everything, be very careful that the enthusiasm does not cross a line. These are not over-the-counter drugs. People who sell drugs should be extremely careful and cautious that it will be a violation of regulation. What they're supposed to be used, what are the conditionalities which have to be met, are followed in letter and spirit by those wanting the medicines, by those prescribing the medicines, by those selling the medicines. I think we have to understand that this whole group of agents, which you, as you rightly said, GLP-1 receptor agonists, they're short form GLP-1 related drugs, are an important addition to the treatment of people with obesity, with or without associated problems like diabetes, hypertension, heart disease, kidney disease, etc., etc. The efforts to reduce obesity have been going on for a long time. Several drugs have come, several drugs have gone. It's a complex problem. It's a complex behavioral and physiological problem. And several of the drugs which came in the past, especially those drugs which were acting on the brain to suppress appetite through an impact on the chemical wiring of the brain, had to be discontinued because of the risk of behavioral problems, of mental health issues, and even suicidal problems. So the availability of agents to help a person reduce weight was actually fairly restricted. These agents were actually initiated for managing diabetes, but it was soon realized that they had a significant impact on weight reduction. So there is no question that for the appropriate reasons, for the appropriate eligible individual, and after due consultation with a trained physician, these drugs are important for management of obesity. And they have till now had not as many complex, irreversible adverse effects as compared to some of the earlier versions of weight reducing medication. So there is reason for this enthusiasm, but one has to, like everything, be very careful that the enthusiasm does not cross a line, and the enthusiasm should be based on due evaluation of the patients, due evaluation of the evidence, and due measurement of all the associated health factors before decision for using these agents is taken.
Sir, as these drugs are almost 1 year is going to be over soon now, the generic versions are also available. Do you think there is importance of pharmacovigilance?
So I think even before pharmacovigilance, I think it is important to understand that these are not over-the-counter drugs. People should not consider trying to get them over the counter. People who sell drugs should be extremely careful and cautious that it will be a violation of regulation if they sell it without appropriate prescriptions, because the Central Drug Regulatory Authority, CDSCO, has given very clear guidance for what these agents should be used, and therefore this part of surveillance is very critical, that what they're supposed to be used, what are the conditionalities which have to be met, are followed in letter and spirit by those wanting the medicines, by those prescribing the medicines, by those selling the medicines. That's the first part. Pharmacovigilance is important because most drugs, and that's true for any drug, post-marketing surveillance sometimes, because of larger numbers, longer duration of follow-up, brings up more details about the drug which help taking decisions in the future. So I firmly believe, like all agents which are taken on a chronic basis, pharmacovigilance is an important part of this, the sort of the natural history of releasing agents like this into patient therapeutics.